Everybody tap in. It's Wednesday night. Do I have any nurses in here from El Salvador? Do I have any nurses from California? Where are my nurses from Kenya at? Haiti? It is Wednesday night here in the United States of America. If you want to be a nurse, you got to pass NCLEX. And we're studying topics from right here, as always. You know what? Anytime I'm excited about it, it just the tech just be on its own thing. I was saying that we're studying subjects tonight that are super easy on the surface, but when we approach them for critical thinking, they become challenging. And I find that BPH is one of those subjects. So I was studying it in the Quick Facts book, which is what I was going to grab. Tell me what page it is on. If you have Quick Facts, we're busting out this book. Everybody should have Quick Facts for NCLEX if you are preparing for your nurse licensure examination. And the reason why I go into this book is because of the critical thinking foundation that comes from it. Okay. So you got to know the facts if you're going to critically think. So welcome to this class. We're going to jump into it. But of course, don't forget that earlier today, did you catch it? We had it's on page 11. Thank you so much. We had Safe Nurse Now, the staffing company that I am a part of, that I'm so proud of. We have LPNs working, we have RNs working, and I'm really seeing how we are making a difference and able to position those nurses to not only have the freedom that they want in nursing, but also the flexibility and to be able to be valued. When you become a nurse, you have to end up in a place that values your contribution, that makes you feel good about coming to work. No crying before work, no stressed on your days off. That's not the life I want for you. So if you're interested, Safe Nurse Now, go to remarnurse.com/jobs and check out the jobs that we have right now. They are amazing in there. So check that out. We're talking about benign prostate hyperplasia. How many people feel good about this subject? You feel like you know it. You feel like I'm going to crush critical thinking tonight. I hope that's the case. If you study page 11 in Quick Facts, you will be able to follow right along with me. I'm kind of procrastinating so that you can get ready. You can get out your notebook. You can get out your Quick Facts. You can join class. I know it's Wednesday, but we got to dive into it, okay? All right, so we're going to jump into it. How do I want to start this? I think I want to just start by saying that, studying for NCLEX is part of our grind. Is something that we consistently do. So don't get tired and don't get, be excited about this, because this is one day closer to that NCLEX exam, and that's your big day. Okay. All right. So let's go in here and let's just start talking about this. So when we talk about benign prostate hyperplasia, what we're essentially talking about is a part of the prostate that naturally it's going to get large with age. Now, follow me. The prostate has different muscles and tissues. So there's a smooth muscle that is there, and that causes, tightness and urinary obstruction. When that prostate gets bigger, you have glandular tissue, you have connective tissue. And so that's all part of normal aging. And when we're reading the things in Quick Facts about BPH, let me turn to page 11, because you're right, it's on page 11. And then the surgical procedure that I want you to know is on page 12. So when we're talking about BPH and you're reading it, something jumped out at me right away. Something about this jumped out at me right away. When our patient comes into the doctors or into the clinic, what is going to be the clinical presentation? Is the patient going to come in and say, you know what? My prostate is feeling big. Check me out, doctor. What is going to drive that patient into the doctor's office, which will become the central focus of any NCLEX case study? Any NCLEX case study that you get regarding BPH is going to initially present with what? It's right there. It's right there on page 11. Oh, yes, 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 yes. So anytime we get and I see some answers that I'm not happy with, and I see some answers that I'm happy with. I'll get to all of them. So anytime we're talking about BPH for NCLEX, it's going to be a problem with urination. That's what's going to bring our patient there, okay? So I had that on page 11 because I don't want you to miss it. Now, another thing is this a condition of a younger man or an older man? I highlight the fact that this is a condition in an older man for a reason. And it takes you all the way back to pathophysiology. Let me see. Let's dive into it. Let's do this case study, okay? I wrote this case study based off of the stuff in Quick Facts just to make sure that you're studying it the way you're supposed to be studying it, okay? So 68-year-old male comes in, presents to the clinic with complaints of difficulty urinating, a weak stream, and frequent nighttime urination. A digital rectal exam reveals enlarged, firm prostate, and post-void residual scan shows significant urinary retention. Okay? All these words you should know. We're not defining words. We just are speaking the language of a nurse. So this is your patient presentation. Now, one of the things that you need to be mindful of is we said when our patient comes in, they're going to have issues. Okay. I like the comments tonight. Keep it up in the comments. Also share this video. This is a study session. Let me ask you this, because we feel good about BPH. If it is benign prostate hyperplasia, should the nurse expect to document pain when the mass is palpated? Not that you'll be palpating the mass, but if the doctor palpates the mass, would the patient say, yow, hey, that hurt. This hurts. What do you say? Okay. I see some yeses. I see some nos. Okay. And this is what I mean when I talk about knowing and then being able to critically think. Because this is a pretty basic question. We haven't gotten to the critical thinking just yet. So if you get this one wrong, you got to get back to Quick Facts. Okay. Correct answer is no. The mass that is palpated will be non-tender. There'll be no pain. There's nothing about pain here, right? There's nothing about pain in the introduction of BPH. So be very careful about that. Now, let me ask you this. This is critical thinking. The doctor tells the patient the prostate has grown. The nurse is aware this is because of which hormone? Which hormone are we working with here? Is it testosterone or is it estrogen in BPH? I love Wednesdays. I love coming to, this is just a quick hit of like, okay, this is where you need to be. You're on the right track. You're doing good. Lots of A's, testosterone, lots of A's showing up in the comments. All right. Remember what I told you. This is a condition that happens with males, right? So everybody that picked A, you're wrong. Correct answer is estrogen. The reason why the prostate is beginning to enlarge is because what is testosterone doing in the older male? Is it going up? Is that older man like, yeah, I'm feeling it. Testosterone flowing through my veins. No, the problem is that testosterone naturally goes down. Just like in women, estrogen naturally goes down. And so because in males that testosterone is leaving, that estrogen level can creep up. Estrogen causes things to get big. Okay? Estrogen causes things to naturally get big. So this, contrary to what the other nurses may think, ReMar nurses know that this is a problem with estrogen. And so some of the things that a patient may do is take testosterone. A male patient may take testosterone. Okay. And these are just the things that I wrote down in my quick facts today when I was, just preparing for this class. I'm like, okay, look, we got to talk about this. Okay. So as we're talking about this, what's the next question I have? So, all right. So we're going to get into some more practice questions, but can you repeat why it's estrogen? Because the aged male client is going to have a reduction of testosterone. Men have estrogen and testosterone. Men have estrogen, just like women have testosterone. So there will become an imbalance. That's why. The estrogen is already there. It's not something that's new that's popping up. It's there already. Okay. All right. So again, remember, this is a problem with a male that is increasing in age. Okay. The lifestyle is either sedentary or obese. I have here hypertension can be a risk factor, heart disease can be a risk factor, and then also diabetes mellitus. Okay. When we talk about the clinical presentations, of course, in the beginning, I said this is going to be a problem of urinary tract dysfunction, a lower urinary tract dysfunction. So not the bladder is the problem, but the patient is having this urge because the prostate gland is pushing on the bladder. Okay. You say you've seen those in the 40s who have it. I can believe that. I can believe that. So urinary frequency, urgency, nocturia, straining, dribbling, splitting, urination. Our lifestyle modifications, the management, of course, is going to be noted as this: less caffeine, which gives you the urge to use the bathroom, alcohol, bladder irritants, want to get rid of those. Naturally, saw palmetto can be used for this. I believe this is also in quick facts. Know your herbal medications. Just spend 5-10 minutes studying them. Okay. Medical, you can do alpha, adrenergic blockers, and finasteride. Surgery, prostatectomy, and TERPs. TERPs is on page 12 in quick facts. Get familiar with that. Get familiar with that one. Okay. All right. Now let's also dive into when people ask me what is the V2, it's really simple. 2 books, 1 video course, 1 NG and Q bank. All right. So we're going to go into the Q bank of the V2 and ask questions about this. Now I've been cooking y'all with this BPH because there's some things that you know, but there's also, I can tell there's some things that you don't know. So we're going to go over some more things that you don't know, but I got a ReMar nurse here and I want to bring her on because we haven't had a ReMar nurse in a minute, right? So let's bring her on. I'm so happy. Hey, how you doing?
Hi, I'm doing great.
I can imagine. What do you have to tell us? Let me close quick facts and let me give you the screen. Hi.
Hello, hi. Um, I took my test on March 4th
Okay.
and I went in very nervous. I actually graduated from school in 2017. I had taken the test 2 previous times and failed. Um, I had test anxiety really bad. And so
Okay.
I went into the first 2 tests thinking that if I answered all of these different questions from all of these different programs and books, that I would do really well. That wasn't the case.
Mm,
So this time I actually went in with the whole like another direction. So
okay.
I decided to do what you suggested, and that was to really learn content and not worry about answering questions.
Nice.
Um, I purchased the V2. I purchased it for 90 days.
Okay.
However, I have to say I'm a bit of a procrastinator. So
Uh-oh.
for the first like 40 days, I didn't study the way I was supposed to. And as I was approaching the 30 days, I said, okay, Sharnette, you have to get serious about this. It's now time.
Mhm.
And then I began to study every day for 3 hours a day, as you suggested. Um, I learned a few different ways. So I like to hear things, I like to see things, and I like to write things.
I
So
got
I
you.
began to listen to your lecture. I began to make some note cards, and then I would listen to the lecture, make my cards, and listen again.
Got it.
So if there was a lecture that would take 25 minutes, it would take me an hour to get through that lecture.
Oh, okay. Okay. All right.
I, al- I also studied quick facts.
Love that. Yeah.
And so as I was going through the lecture, I would try to, I definitely went by your study guide
Yeah.
when you would say, okay, do this week, do this time. So I would go through that. And honestly, I'm going to be real honest. In the question bank, I only answered 184 questions because I was determined not to get into that whole thing with answering questions. I really wanted to learn the information.
Oh my goodness. Did you feel like when you were studying that you had less anxiety? Did you like, how did you deal with that as well? Because you studied the content. How did you deal with your anxiety?
Okay. So I honestly started to pray. Whenever I would study, I would pray. But when I got to the testing center, I showed up an hour ahead of time.
Yeah.
I did not try to study before I went, and I didn't cram the night before. I made sure that I got proper sleep. I just kept really declaring and decreeing to myself that I knew the information and that now was time. Now is the time to pass. You're going to pass. I took all those negative thoughts out of my head and just
Yeah.
began to be very positive. And I just kept telling myself to take your time. So I got 133 questions, and it did take me 4 hours to do those
Okay.
questions.
That's all
Yeah.
right. All right. You took your time and you did
hmm
it your way. Can you talk to me about what it was like to fail NCLEX the second time? And how long did you wait in between the second failure and this third attempt?
Okay. So the second failure was I just felt so defeated
Yeah.
because you have your family kind of depending on you and waiting for you to pass this test so
Mhm.
that you can actually change your lifestyle.
Yeah.
And so that second test, once I felt so defeated. I waited 7 years.
Oh,
7 whole years because I just felt like I'm not gonna pass. I kept telling myself I'm not gonna pass. What's the point in putting myself through all of this and studying all these hours and I'm just not gonna pass. So I waited 7 years and I just really had to sit down with myself and say, listen, you have to finish what you've started. I always tell my kids it's important to finish what you've started. So I had to take my own advice and I just really buckled down. I'm a person who will put everyone before me, right? And so I finally decided to not do that anymore and to put myself first. So I really took those 30 days and began to study and take my time and go through the content.
now I want you to hear yourself. You brought the 90-day package, but you only needed 30 days to get through the system. So you only needed 30 days. You didn't need 7 years. That's how much you
Absolutely.
were ready to pass. But you know what? The person that you needed to be showed up when you needed to show up. Okay. So I'm sure during that time, you learned a lot about yourself that even brought you to this point. So, how did you find out about ReMar?
So how did a friend told me about ReMar. She had taken the NCLEX a few times and failed, and then discovered ReMar and passed the test. So she's like, "Hey, Sharnette, you really need to look into this program. It's really good." I think that what helped me is the way that you teach things in lecture.
Yeah.
You explain things really well. Your voice is very comforting. And so for me, the detail and everything, being able to kind of go back and look at something over and over and over again if I needed to,
Yeah.
really helped.
So, why did you come here today to tell me that you passed?
I came to tell you that I passed, but all the other people out there who have test anxiety or
Yeah.
who have waited a very long time because maybe they failed a few times and they feel defeated
Yeah.
and they don't know if they can do it. I came to tell them that you can pass, you can do it. You have to put the anxiety aside, you have to stop being a procrastinator, you have to put yourself first and really dig in and learn content, not answer questions. So I just came to motivate that person who used to be me, who
Oh.
just felt defeated and that felt like it wouldn't happen.
Yeah. The hardest part is taking the first step. And so many people come here on Wednesday nights, but they never get into the program. They just come here and they watch the class, but they never take the next step what difference did it make for you having the program and having structure in your studying?
I would not have passed without the program, without your tips, without the prayers and my quick facts book to remind me that I could pass this test. I would have never passed. The lectures just offer so much, so just
Different.
detail on what you really need. It takes the guessing out of it. Everything that you've ever said in lecture, I went away from trying to memorize things
Oh,
to
mm-hmm.
actually learning the content. If I could
Understanding.
give any advice, it's just learn the content. Like you can't memorize this stuff. It doesn't work that way. It's
No.
real life. Um, it's real
Yep.
life situations. So you really have to be able to apply the knowledge that you have. They're not going to ask you that simple stuff that you can just remember. You
No.
really have to dig in. So the lecture helped me so much. You really need to. It's the best money I've ever spent.
Come on now. Come on. And honestly, in the grand scheme of things, is so little compared to the lifelong career that you're going to have in nursing. You have that nursing license, you have it, Nurse Smith, for the duration
Yes.
of your pleasure. However long you want to be in nursing, you have the ability to be. And when you're ready to walk away, you can walk away from it. But the cost, I think most people focus on the cost of money, is really the cost of
Mhm.
time, is really the time that is wasted when you don't actually set yourself up for success. So I thank you so much. I thank you
Thank
so much.
you. I'm a ReMar nurse.
My
Yay.
favorite thing to say. So what's next? What do you want to do in nursing? What are you going to do in nursing? What?
Well, my goal is to open up my own healthcare agency.
Oh,
So that's what I'm going for. I have been an LPN since 2012. I'm now a wound care nurse. So I plan on opening up an agency soon.
let's do it. You can do
Yeah.
it. Yes, yes. With all that experience, now you have the RN, and now you're able to be an entrepreneur RN. And
Yes.
congratulations, you guys. This is Winning Wednesday. This is what it looks like. It looks like being able to make plans for your future with a tool that's going to get you there faster, right? And
Yes.
so I just want to say thank you so much for coming, and thank you for choosing ReMar. You had many choices, so many choices, and I'm so glad you gave me the opportunity to study with you during this journey. So thank you.
Thank you for having me.
All right, all right. See you later. Oh man, wait, you gotta say bye. I gotta say bye to you again. Let you say bye.
Bye bye. See you guys later.
Bye. So listen, guys, we are not here for a long time together. We're here for a good time. That's it. We're here for a good time. So if you do the work, if you stay consistent, and if you're really honest with yourself, do what you need to do. I mean, I'm telling you this, and sometimes I feel like a broken record, but then when we have nurses, you can get into the program for free. Everybody can do the free trial of this program tonight, and you'll be able to do questions and lectures and really see if it's right for you. Go to remarnurse.com/FREE free and get the free trial. I can't tell you how much more structure you will have. And in addition to that, it saves you time. It saves you time. We're going to go into the question bank of the V2. I love that. She says it's the best money she ever spent. We're going to go into the question bank of the V2 right now, and I'm going to challenge you to evaluate yourself. Oh, come on. Nurse Nicole, I studied for 2 months and passed on the first try. So worth it. So worth it. Monique, come on. I want to see you guys' faces. Hello, Professor. Just dropping by to say thank you, past NCLEX RN, just last week, March 11th, on my birthday. Happy birthday. What a great gift you gave yourself. What a great gift you gave yourself. And I know you are not the only one with a birthday this month. I know there are other people with birthdays this month that need that gift. Okay. I need to get this and stop robbing myself out of opportunities. That's a word right there. That's a word. And I'm so glad you're speaking that to yourself. That's the positivity we need to be speaking to ourselves. We are not wasting so much money. We're wasting time. We're wasting time not having our nursing license, because I love it. I love it on this side of nursing. All right, here we go. First question is this. In assessing a client with suspected BPH, which of the following assessments is the most significant? Okay. Is it number 1, painful urination, 2, increased flow of urine, 3, prolonged start of urination, or 4, blood in the urine? What are we going to be looking for? This is critical thinking, okay? This is critical thinking that we're talking about here. Show up to the plate, hit a home run. Okay. Correct answer is absolutely number 3, prolonged start of urination. What are we talking about? Suspected BPH. We know we're going to be focused on the urine, but what exactly are we going to be looking for? Not blood. Not blood. No blood in the urine here. Okay, we're going to be looking for that that difficulty to start, right? All right, here we go. 72-year-old male is admitted to the hospital with urinary retention, suprapubic pain, and difficulty voiding due to BPH. The healthcare provider has prescribed the following orders. Which intervention should the nurse implement first? Number 1, insert an indwelling urinary catheter per standing order. 2, administer tamsulosin to relax the bladder neck. 3, schedule the patient for a non-urgent transurethral resection of the prostate. Or 4, obtain a urine sample to send for urinalysis and culture. What is the critical thinking step that this nurse should make? I'm glad you're here today. I only have a few more minutes with you. And this is the big part, okay? This is the big part, is how we end the night. Correct answer, number 1. Your patient is coming in with essentially the inability to void, and that's what's causing urinary retention, suprapubic pain, difficulty voiding. That's the issue that you need to correct. Good job. Number 1, you saw it. Pat. Here's question number 3. The nurse is giving 2 milligrams of terazosin, an alpha blocker, for a client with BPH reporting nocturia. Prior to giving this medication, the nurse should assess, is it 1, urine output, 2, blood pressure, 3, sleeping, 4, neuropathy. What do we care about here? It's been such a fast study session. I can't believe we went through this information so ferociously. I see a lot of 1s. I see some 2s. Correct answer here. Absolutely. Number 2, we got an alpha blocker. Even if you didn't know the medication, you had a cheat code which says it's an alpha blocker. And you might not know alpha blocker, but you definitely know a beta blocker. So you got to make the leap. You got to make the connection sometimes. Okay. So we're worried about blood pressure. All right. Question number 4 is this. The nurse is caring for a client who underwent a TURP procedure and has ongoing continuous bladder irrigation. To have an effective irrigation, the nurse should increase the flow rate when, number 1, there is 0 drainage. 2, there is bloody drainage. 3, there is yellow cloudy drainage. 4, the drain is slow. What do you say? I know I really like this topic too. Like from a surface level, it's just like, nah, but it's really kind of interesting. It's really kind of interesting. Okay, correct answer is number 2. This comes straight from the Quick Facts book, actually. Bloody drainage. We don't want bloody drainage. What color drainage do we want after that TURP procedure? We want it to be my 4-year-old daughter's favorite color ever right now. Okay. So we don't want it to be bloody. We want it to be pink. We want it to be pink. All right. So that is the correct answer for here. Now, listen. on Wednesdays, my goal is not for you to, be discouraged. It's not for you to feel like, oh, I don't know anything. It's really for you to have direction on what's the next step you should be taking. So for one of you, it is to schedule your test exam because you don't have a test date, but you have an ATT. Get that exam date scheduled. For somebody else, it is to get into the V2 system. Get going. 2 books, 1 video course, 1 question bank. That's it. Okay. That's somebody's step. Somebody else's step is to renew the V2 because you had it and you didn't study it, right? Or you had it and you procrastinated. Like Nurse Smith, you procrastinated 60 days and then the last 30 days you got busy. So somebody needs to get into it. I'm saying all this to say that if you want to pass NCLEX this year, guess what? The first quarter, March, January, the first 3 months is already done. Okay? The first 3 months is already done. And so you got to make moves that line up with your goals. Stop putting other people first. Stop deprioritizing yourself. You're doing everything that everybody else wants, and you're not actually accomplishing where you need to be. Okay? I'm the type of person that I've been saying this. I don't want any regrets. When I'm looking back over my life, I don't want any shoulda, coulda, wouldas. I am going 120% after the things that I want because it's nobody else's responsibility to live my life and enjoy my life but me. I can't wait on my kids. I can't blame it on my husband because they all have their time, right? And so a lot of you guys are caught up in the nurse servitude part, but there's also a nurse experience that you also should be going after, okay? So you didn't come this far to quit. Let's go to the next level. Get in that V2, y'all. Come on, and let's get this license in your hands this year. This is the whole entire goal. This is the whole purpose why you're doing this. If nobody told you this, I'm coming back to class on Monday. Every Monday, every Wednesday. Every Monday, every Wednesday, I'm showing up for you. I just need you to show up for yourself. That's the more challenging part. I already got my nursing license. I already have a nursing license, but I'm showing up here because I'm wanting you to have the same thing. And I know you can do it. You just need some encouragement, all right? So I will see you all on Monday. If you need me, please just send me an email, support@remarreview.com, support@remarreview.com. We can finish the conversation in there and do what you need to do. It's Winning Wednesday. Get on your winning plan. You showed up. Now do the next step. Okay? All right, everyone. See you later. Bye-bye.